And purpose of our webinar today is to describe the 2025 call for proposals. I'll step you through um, some of the major components of this call, the kinds of research that we are looking to fund through this call for proposals. We'll talk a little bit about the mechanics of how to submit an application for this funding opportunity to the foundation. We'll talk about some key dates and deadlines. We'll talk about some key resources that we want to make sure you have access to. And in the latter portion of the hour today, we will have time for Q&A, and I'll tell you how to submit your questions in just a moment. So that's our agenda for today. Give you an overview of our Systems for Action research program, an overview of this 2025 call for proposals, talk a little bit about the mechanics of how to submit an application, and then we'll get into Q&A for today. A few housekeeping issues. Today's session is being recorded, and we'll be posting a link to the recording of today's session for anyone who's not able to be with us live. That link will be posted on our website, along with the copy of the slides. It'll be posted on the website at the link that you see here. It'll also be, we'll email those links to everybody who has registered for today's webinar. Everybody who's attending this webinar today, you're going to be muted because we've got hundreds and hundreds and hundreds of people with us today. And so you won't be able to vocalize during today's webinar, but you can submit a question about this funding opportunity at any time using the Q&A box that you should see down the lower portion of your screen. Type your question in at any time during today's webinar. We'll get to as many of those questions as we can during the latter portion of the hour today. If we don't get to your question, we'll be able to respond to it via follow-up email. And as long as you've registered for today's webinar, you will get those emails. So thank you for joining us. Let me introduce some other folks who are key people in the Systems for Action research program. First and foremost is our program officer at the Robert Wood Johnson Foundation, Dr. Isabel Cuervo, our fearless leader in this research. And on the right-hand side of the slide, you see some key members of our staff at the National Program Office for this program. Again, that's located here in Colorado at the University of Colorado School of Public Health. They include Carrington Lott, our Deputy Director, Sazina Balmashkin, who's with us today, our Program Manager, Julie Reslahim, Phoebe Downer, Nate Demke, and Lene Bounds. And so you're likely to hear from all these people as you get to know the program, and particularly as you move forward and submitting an application, perhaps in response to this call, or participating in one of our S4A events, like our regularly recurring Research in Progress webinar series, our newsletters, and other communication mechanisms. So I want to thank all of our S4A partners and happy to introduce you to these people. So just to talk a little bit more about the S4A program. This S4A is a signature research program of the Robert Wood Johnson Foundation. It was created about 10 years ago, along with a series of other 4-action research programs of the foundation, designed to build new evidence and actionable scientific evidence about how to achieve a culture of health across the United States. Our focus in Systems for Action is in studying systems, delivery and financing systems for medical care, public health, and social services. And in particular, we study innovative new ways of helping those systems align their efforts and activities toward the goals of improving health and especially advancing health equity. So over the past 10 years in our program, we have funded studies all around the country, again, testing innovative ways of aligning medical, social, and public health systems in ways that can help those systems work together toward the goals of advancing health equity and especially dismantling and disrupting forms of systemic racism and injustice that are embedded in these delivery and financing systems. You can find more information about our program, our research agenda, and the many studies that we funded throughout the the history of the program. All that information on our website, systemsforaction.org. Encourage you to spend some time there to get to know the program in greater depth. That brings us to the 2025 call for proposals. It's the most recent funding opportunity released by the Systems for Action Research Program. Um, with this call, we are seeking to fund community-led pilot studies that will test new system alignment interventions. System alignment interventions are strategies that, again, work to align and help medical, social, and public health systems work together to advance health and well-being for communities, specifically for communities that experience systemic racism. So this call is to fund pilot studies, testing new system alignment interventions to accomplish those goals. The studies that will be funded through this call must be led by a community-based organization, which in this call is defined as a nonprofit organization or a government agency or a tribal organization that serves communities that are affected by systemic racism. So very, very important this in terms of eligibility for this funding opportunity. You must be a community-based organization meeting that definition. The research to be proposed through your application must engage all three types of systems that are the focus of our Systems for Action research program, those being medical systems, public health systems, and social service systems. That's been a hallmark of our program throughout its 10-year history, is in studying ways to align and integrate all three of those types of systems. So that also is an essential ingredient in this call. We are looking to fund pilot studies through this call. So these pilot studies being early small scale tests of the feasibility and acceptability of the system alignment intervention that is being proposed. So that is very important as well to recognize these grants will be to fund pilot studies testing feasibility, acceptability of the intervention, and the potential to improve health and well-being for populations that experience systemic racism. Very important, and another hallmark of our S4A program for many years is engaging people with lived experience in systemic racism and other forms of injustice and inequity, engaging those people directly in the research that is proposed in developing, refining, and testing the proposed system alignment intervention. This is a research program. S4A is a research program designed to produce generalizable scientific knowledge and actionable knowledge that can be used in settings across the country. So it's also important through your proposal to have an experienced research team involved who can assist with the design and implementation of the scientific and research aspects of the proposal as well. So these are some key features of this particular call for proposals. If you're familiar with previous calls for proposals that we have released in past years of the S4A program, in every year the call for proposals is a little different in terms of the focus area and types of projects to be funded. So even if you've seen our previous CFPs released in 2024 or 23 or 22 or 2017, please pay attention to this 2025 CFP. Again, it's a bit different from our previous released calls in terms of the focus, the criteria, the types of projects that we are seeking to fund this year. Again, one of the unique features of this call this year is that we are seeking to fund pilot studies only. So small scale tests of feasibility and acceptability. So the awards that the foundation will be providing under this call will offer up to $200,000 in total cost per study to support the pilot testing of the system alignment intervention that's being proposed. These awards will be for up to 12 months in duration to conduct the pilot testing activities. The foundation intends to fund up to 5 studies under this call. And again, the applicant organization must be a community-based organization that works directly with populations that experience systemic racism. Again, in that, look carefully at the eligibility criteria and our definition of community-based organization. Um, and for this, under this call, the community-based organization who serves as a lead applicant organization may allocate up to 50% of the total project budget to a subcontract with a research partner um, who will facilitate the research and scientific aspects of the project. So that's another um, uh, provision in this particular call. Um, Again, as a pilot study, the projects that will be funded under this call should be designed to generate preliminary evidence that will be needed to pursue future subsequent funding for larger scale research about the system alignment innovation that is proposed. So these are pilot studies that are designed to position the applicants well for future larger scale research funding that could study the effectiveness and the impact of the proposed system alignment intervention. So these are, again, as pilot studies are, designed to produce that preliminary evidence of feasibility, acceptability, and potential for impact on the populations of interest. There are three special topics of interest that are described in the CFP document for this year. And so I want to highlight those three areas briefly and make sure that you encourage you to read more deeply about these three areas that are described in the CFP document. Again, applicants are welcome to propose research on topics other than these three special topics of interest, but we certainly want applicants to consider these three topics because they are special areas of interest and emphasis for the Systems for Action research program this cycle. The first special topic of interest relates to projects that address resource inequities across systems. And so under this special topic, we are interested in funding studies that would test ways of equitably allocating and sharing resources across medical, social, and public health systems in order to support collaborative solutions to systemic racism. So projects under this topic area, they might focus, for example, on helping minority communities and minority serving institutions secure equitable shares of funding and staffing and other resources needed to meet the needs of their communities. Studies under this topic may test novel financing mechanisms, novel payment models, staffing models, other resource sharing models, again, that can help more equitably spread resources across relevant medical, social, and public health systems, again, to support collective actions and collaborative work to address systemic racism. Also, studies that are designed to address the so-called wrong pocket problems that exist across the health and social sectors would also be relevant under the special topic areas. So projects that are testing interventions designed to address the imbalances that can exist between organizations that bear the cost of implementing collaborative solutions versus those organizations that bear the benefit that realize the benefits from that collaborative work, to try to distribute those costs and benefits more evenly and more equitably among the collaborating organizations in medical, social, and public health systems. Those are all kind of topics of interest under this first special topic, number one. A second special topic that's described in our CFP this year, projects that are designed to strengthen the voice and authority of marginalized communities. And so studies fitting under this special topic might specifically test ways of strengthening the voice and the influence of marginalized and racialized communities, also including indigenous communities, and giving those voices greater visibility and authority in shaping how medical, social, and public health systems operate in their communities and how they are designed to serve these populations. So studies that fall under this special topic area might test novel governance models and decision-making models, such as new ways of comprising governing boards and ensuring governing board representation and authority. Studies that fall into this special topic may test novel community deliberation and decision-making structures and processes, such as participatory budgeting models. Projects may test novel approaches to public reporting and disclosing and disseminating data about health and social systems in ways that can result in more equitable operations, and just studies that are testing a whole other types of innovative approaches to community-driven oversight and community accountability structures for health and social systems would be relevant here. Again, as with all of our S4A studies, we're especially interested in studies that directly engage people with lived experience related to systemic racism, in engaging those communities in developing solutions to systemic racism. Um, Again, also relevant under this special topic would be projects that utilize indigenous governance models and community-led decision-making processes that honor indigenous values and practices. Third special topic of interest is described in this year's CFP. It relates to studies that are testing equitable use of decision support tools within medical, social, and public health systems. So studies that would be responsive to this special topic area might be testing novel decision support tools or technologies or algorithms that are designed to help medical, social, and public health system decision makers identify forms of systemic racism that are operating in their systems and helping those decision makers work together to dismantle or remedy those forms of systemic racism. So these projects might involve novel use of data and data systems and algorithms to detect instances of systemic racism and bias, and or to flag possible instances of unjust racial patterning in how health and social systems operate. Studies that fall into this special topic may also be designed to test new policies and new professional practices that are designed to reduce the risk of implicit bias and discrimination when health and social system personnel are making decisions about operations within those systems. So that is the third special topic of interest. Again, more information about these special topics and examples of the kind of studies that might fit within them are described in the written CFP document. So we especially on page 5 of that funding opportunity document. So we encourage you to take a deeper look at that. Again, applicants are welcome to propose studies that address other topics other than these 3 special topics of interest, as long as they fall within the overall focus of the CFP on testing system alignment solutions that are designed to address forms of systemic racism that operate within medical, social, and public health systems. Okay. Talk a little bit more about the characteristics of applications that are likely to be found to be responsive and successful under this call. I've already touched on several of these, but just to reiterate, first of all, studies proposed in this call must be designed to engage all 3 of the sectors or systems that are the focal points for the Systems for Action research program. Those 3 systems are medical care, public health, and social systems. We use broad and inclusive definitions of each of those 3 types of systems, and more information about those systems and how we define them in this program can be found in the CFP document, and also on our list of frequently asked questions that can be found on the S4A website. So definitely encourage interested applicants to make sure you read those definitions carefully about how we define medical care systems, how we define public health systems, and how we define social service systems for the purposes of this CFP. Applications need to provide a clear and convincing logic model describing your proposed system alignment intervention and how that intervention, if it's successful, how it would address health equity problems, and specifically how it would address forms of systemic racism and inequity. This is a pilot test research grant, and so it's also important for applications to use rigorous and relevant scientific methods for pilot testing your proposed system alignment intervention. Again, pilot testing on a small scale and evaluating these key issues of acceptability, feasibility, and potential for impact. Again, as I mentioned earlier, these projects must be led by a community-based organization that has experience in working with communities that experience systemic racism. And so your application should also include a clear description of how that CBO applicant will work in partnership with the research teams and research partners to design and carry out the pilot testing research activities. Applications should also show a clear commitment to community initiated and community engaged research approaches, including strategies for incorporating individuals with lived experience related to systemic racism in the design and the conduct of the research, and also demonstrating the ability to engage people from all three of the sectors and systems that are the focus of this call. Again, medical care, public health, and social services. Um, we also look for applications that have a plan for disseminating the results of the proposed research out to audiences who can make use of those results. And so a dissemination strategy for helping relevant audiences access and use the study findings from the study is also very important. And finally, especially for this opportunity, because these are pilot studies, we want to see applications that describe a plan for how the pilot test results will be used to pursue subsequent future research opportunities to further test and evaluate the system alignment intervention. So these would all be things that we'd be looking for in successful applications under this funding opportunity. Okay, this slide shows you a few key resources with links to resources on the Robert Wood Johnson Foundation website and on the Systems for Action website. So can encourage everyone who is interested in developing an application to make sure you've accessed each of these resources and read through them carefully. Keep them handy as you're developing your application. The first link is to the landing page for this funding opportunity on the Robert Wood Johnson Foundation website. It's a long HTML link, but please make sure you have that. That's the main page that has many of the resources that you'll need. Secondly, make sure that you download the full 18-page funding opportunity brochure that is available on the CFP landing page. It's a PDF document. It describes in much greater detail what I'm talking to you about today. This funding opportunity, the kinds of studies that we hope to support through this opportunity, all the eligibility criteria and information about how to apply. The third bullet point is a link to our frequently asked questions or FAQ page on the Systems for Action website. This page is updated continuously as we receive new questions about the opportunity. So please make sure to access and review the information on this FAQ page as well as you are developing your idea for an application, and make sure to check back frequently because we update it as we receive more questions about this opportunity. Fourth bullet point here, and the link there, very, very important. There are two templates you will want to use as you begin to develop your application. One is a template for the proposal narrative, and the second is a template for your budget. Very important to access these templates and use them as you're writing your application, the written portion of your application, and then as you're developing the budget for your application. Both of these templates provide much more detailed guidance about what to include in each of these elements of your application. The proposal narrative template is especially important because we have embedded additional instructions and guidance about how to organize your written proposal narrative, all the way down to what headings and subheadings to use, including page recommendations for each of those subheadings to add up to keep you under the 10-page maximum for your proposal narrative. And again, what to include, what kind of content to include under each of those sections. So please make sure to download that proposal narrative template, and also make sure to download your budget template as you begin to work on your applications and use those templates. Type your information directly into those templates so that to maximize your chances of being responsive to this funding opportunity. The last two bullet points are a little more tangential, but could be useful contextual information for you. One is a link to the SRA program's research agenda. And the second, the last bullet point is a link on our website to the descriptions of all the projects, the studies that have been previously funded um, by the through the Systems for Action Research Program. So all of these hopefully useful resources for you as you're developing your ideas and ultimately developing your application for this funding opportunity. A couple of other resources that we have put together for you to help potential applicants with this funding opportunity. First thing is that we have been hosting weekly drop-in office hour sessions, and we will continue to do this every week from now through the deadline for submitting your application. So you can drop in every week during this office hour session, come in, ask questions, listen to questions asked by other folks, and as a way to hopefully tap into additional guidance and support in developing your application. So we welcome you to drop into these office hours any week, every week, as they are helpful to you. More information on when those office hours are scheduled and how to register for them is available at this first link from our website. You do need to register, and then you can drop in any and every week, and hopefully this will be helpful to you. Secondly, we want to make sure that you're aware that we have a very important component of the Systems for Action program that is designed to provide more customized and tailored technical assistance to community-based organizations that are interested in developing research ideas and research projects that would be eligible for funding from the Systems for Action research program. So if you are, especially if you are a community-based organization, you are eligible to tap into this additional technical assistance and support from the System Alignment Innovation Hub. That's the outreach and assistance component of our program. So more information about the System Alignment Innovation Hub and the types of technical assistance they can offer you is available on their website, just shown here. And you can also email the System Alignment Innovation Hub at the email address shown here, and as a way to tap in to learn how to engage and take advantage of the technical assistance and support offered by the Innovation Hub. But again, this is support that is available only to community-based organizations who are again interested in pursuing developing research ideas relevant to the Systems for Action research program. So definitely feel free to take advantage of that support as well. So just a few more highlights and information more about the mechanics of submitting an application for this funding opportunity. And number one, please read that full 18-page description of this funding opportunity that's available from the RWGF CFP landing page. Again, there's a lot more information, written information about this funding opportunity and what we're looking for. And so again, you can download that CFP document from the Robert Wood Johnson Foundation website. One of the things that you will see described in that CFP are the selection criteria that will be used to evaluate and ultimately select applications to receive funding from this call. So you want to pay special attention to those 6 selection criteria that will be used, again, to review your application. Those are described in detail on pages 11 and 12 of a CFP document. Again, that's what our external reviewers and our National Advisory Committee will be using to evaluate applications and ultimately to prioritize those applications for funding considerations. So you definitely want to keep those criteria in mind as you're developing your applications. I mentioned already there are templates available for developing your proposal narrative and your proposal budget. So you want to make sure you download each of those two templates, the proposal narrative template and the budget narrative template, and use those templates in developing your written proposal narrative and then in developing your budget and budget narrative as well. Very, very important because additional guidance is embedded in those templates that will be very helpful to you. And again, that proposal narrative template tells you more specifically what to include in your narrative. It tells you how to organize that in terms of headings and headings, and it even gives you page length recommendations for each of those major headings of your proposal narrative. So really important guidance. Just can't put too much emphasis on that. Please make sure you download and utilize that proposal narrative template because it just provides you with a lot more guidance, and it'll be much easier to develop that application if you're using that proposal narrative. A few more notes on eligibility. I've already referenced this, but repetition sometimes is a good thing in understanding these kind of opportunities. Um, so again, organizations that are eligible to serve as applicant organizations for this call are these organizations must be community-based organizations that include um, nonprofit charitable organizations organized as 501c3 tax-exempt organizations, or they can be local or state government agencies, or they can be tribal organizations. So your organization must fall into one of those three buckets: 501c3 nonprofit, a government agency, or a tribal organization to be eligible to serve as the applicant organization under this call. Preference will be given to applicants that are either public entities or nonprofit organizations that are tax exempt. Applicant organizations must be based in the U.S. or one of the U.S. territories to be eligible. Um, And for some organizations, it is allowable if your organization chooses to use the services of a fiscal sponsor to support your project's financial management and grants management activities. That's accessible. That is acceptable under this call. And so you may as a community-based organization, you may choose at your discretion to use a fiscal sponsor to help with those administrative activities. I should mention, and this is highlighted, this is described in greater detail in the CFP. Research organizations, academic and research organizations are not eligible to serve as the applicant organization under the CFP because we're targeting community-based organizations. So if your organization is a university or an independent research institution, you would not meet the eligibility criteria as a CBO under the CFP. You would be eligible to serve as a research partner to a community-based organization and to be funded through a subcontract with the CBO applicant organization. But universities and private independent research institutions are not eligible to serve as the applicant organizations for under the CFP. So that's important to recognize. And again, more detail is described in the CFP about those issues. So important dates to remember. The CFP was launched back on January 15th. We are holding weekly office hour sessions every week up through the deadline for this application. So you can register for those weekly office hour sessions from our website, a link that's shown here. The deadline to submit your application for this call is June 4th, 2025 at 3 p.m. Eastern Time. The foundation is not able to accept late submissions for any reason. So please keep that deadline in mind. Please start the process of developing and submitting your application through the foundation's electronic grant submission system. Do that early. Do not wait till June 4th to start that process. And don't expect that you necessarily will be able to get assistance if you run into trouble in the hours right before that deadline hits. So please start early, access the foundation's application submission system early, access it now, get in the system, make sure you're registered for it, download the templates, get familiar with the elements that you'll need to upload and submit as early as possible. Don't wait till June 4th to do that because we all know that the internet can be finicky and websites can be finicky and you know, problems can happen very close to deadlines. So keep that in mind. The foundation anticipates notifying applicants of funding decisions on or about August 22nd. So if you are selected for funding, you can expect to hear from the foundation around that date about those funding decisions. And these grants will then be designed to start on or about October 1st, 2025. And again, these will be 12-month awards. They'll run from October 1st through October 1st, 2025 through September 30th, 2026. So those are some key dates to keep in mind. With that, I think we're going to move into the Q&A portion of today's webinar. So I'm going to pull up our list of questions and we'll start going through these. And again, you can feel free to type a question that you have use the Q&A box at the lower portion of your screen and to type your question in, and we're going to get to as many of these as we can. First question asks if institutions with substantial government funding feel it necessary to rebrand public-facing material about programs away from DEI language. What will the approach be to be understanding how we communicate studies funded on that mechanism? So that's an important question. We've gotten a lot of questions about this. I will say a couple things about this. Number one, the application that you submit to the foundation is considered a confidential document. And so that proposal and any other materials will be held strictly confidential. It will be reviewed by members of the Roderick Johnson Foundation, members of the Systems for Action Research Program and Program Office, and members of our external advisory committee and our external review panel. All that material will be held confidential. And so you should feel free to describe any important elements of your system alignment strategy and your intervention designed to dismantle forms of systemic racism. We encourage you to describe those in as much detail and clarity as you can in your proposal to the foundation, recognizing that language that you use to describe those activities in your proposal to RWJF may be very different from the language that you use to describe your activities in public-facing kinds of forums, and so that's entirely appropriate if you are using language externally that is different from the language that you're submitting internally to the foundation to describe your activities because of the current political environment that we're operating in, and in particular the federal government's priorities around not funding DEI related activities. So it's entirely appropriate for you if you need to use different language to describe your activities externally versus how you describe them in the internal confidential proposal document that you submit to the foundation. So we hope that is helpful. We completely understand the political environment that we're all operating in today. Question, how we define system alignment activities. Again, encourage you to read that 18-page CFP document where we describe in depth what we mean by system alignment. In short, system alignment is an organized set of activities that help medical, social, and public health systems align their activities in ways that can dismantle and disrupt forms of systemic racism that operate in their system. So system alignment activities, anything that can help medical, social, and public health systems work together. This should be an organized approach to align those activities. Again, lots more information in the CFP document, including examples of system alignment interventions. Again, this is a program we've been operating for more than 10 years now. We have a legacy of more than 40 studies that have been funded in this space. So you can see examples of previously funded system alignment interventions that have been tested through previous studies of the S4A program. But in general, a system alignment intervention is an organized set of activities that are designed to help medical, social, and public health systems align their efforts, work together effectively to dismantle and disrupt forms of systemic racism. So we're open to a whole variety of ideas for how to align those systems. Novel decision-making and governance structures, novel financing and funding and payment mechanisms, novel workforce strategies, many other examples of system alignment interventions that you can read about in the CFP document and on our Systems for Action website. Next question I'll move along to, are intermediaries that fund groups directly working on these issues eligible to apply? It's a good question. I would say in general, yes. If the intermediary that you're talking about, meets our definition of an eligible organization, it's a nonprofit or government or tribal organization that works with populations that experience systemic racism. Then yes, you could meet our definition, be an eligible organization to um, apply for this funding. Obviously, the organizations that have more direct engagement with communities that experience systemic racism are likely to have advantages in developing solutions to systemic racism under the theory that people who are closest to the problem often are closest to the solution in terms of new ideas, to solve problems. And so, but again, we recognize intermediaries can also be very, effective in working with those kinds of communities. Um, so I hope that helps to answer that question. Again, encourage you to just read carefully in the CFP document our definition of our eligibility criteria in terms of the kinds of organizations that would be eligible. But an intermediate organization that supports other organizations that work with communities that experience systemic racism could certainly be eligible for this call. Question about, can the interventions that will be tested, do they need to be newly implemented or do they need to not yet be implemented? It's a good question. I think it could be either of those situations. Again, this is a pilot testing. It's a funding opportunity to support pilot tests of novel interventions. And so I'd say if the intervention, if it's being implemented, but there's still not good evidence about feasibility and acceptability and potential for impact, then you have a strong case to make that there needs to be a pilot test to be conducted because we need evidence about feasibility, acceptability, and potential for impact. So I would use that as your guide. If you want to study a system alignment intervention that is already operational, the question is, do you really need to pilot test it, or do you already have the data you need about feasibility and acceptability that will let you pursue, a larger scale study of effectiveness? I would let that be your guiding point. Yeah, if you are lacking evidence about feasibility and acceptability of the intervention, then yes, you need to do a pilot test to establish that evidence before you can go forward. And that's what this funding opportunity is designed to provide. It's designed to support pilot test studies that can provide that early evidence about feasibility and acceptability. So I would use that, in your decision making about, is this funding opportunity right for your idea? If you already have evidence about that your strategy is feasible and effective, then you probably don't need to pilot test it. You need to look for a larger study that can allow you to test the effectiveness and the impact of that intervention. I hope that is helpful. It's a very good question. Yeah, question says 1 year is a short amount of time for a pilot study that involves multiple systems. What are the expectations for what needs to be completed by the end of the funding period? Good question. That is described in much greater detail in the CFP document. We recognize, yes, $200,000 for a 1 year pilot test is, depending on your perspective, that is you definitely have a budget constraint and a time constraint in carrying out these projects. It would say, in the general scheme of general funding environment for pilot test studies, this is a more generous, pilot testing opportunity, because we recognize the complexity of engaging multiple systems in this kind of work. But fundamentally, what we want these projects to be able to have achieved at the end of the 12-month period is evidence about feasibility and acceptability of the proposed system alignment strategy, and also evidence about the potential for that strategy to have a meaningful impact on populations that experience systemic racism. So those are your goals. At the end of this 12-month period, you want to have findings that speak to feasibility and acceptability, either proving that your intervention is feasible and acceptable to its relevant stakeholders, or potentially showing that it's not feasible and it needs to be modified in some way before moving on to larger scale testing. Um, but those are the key elements. Again, more detail is described in that 18-page funding opportunity brochure about what your project should be able to produce at the end of the 12-month period. Question: if the applying CBO has an in-house researcher, do they still need a partner? No. If you're an organization that has internal research expertise, then you don't necessarily need to engage, an outside research team in the proposal. We do encourage you to kind of carefully consider those issues, what the potential benefits that an externally based research team could bring to the project in terms of expertise, and also in terms of having a kind of an objective perspective in being able to evaluate the intervention, particularly if the CBO is also involved in implementing the intervention. It can be very beneficial to have an outside research team involved in evaluating the intervention, to make sure you've got relevant expertise, and also to make sure you've got kind of enough neutrality and objectivity built into the approach. But that's entirely up to you. That's a judgment you need to make as an applicant for this opportunity, is whether you've got the in-house expertise or whether there are benefits to bringing in an outside research partner. Okay, let's see. A question about is our program able to assist with matching organizations with other organizations who may be interested in pilot testing this methodology? We may be able to provide some guidance on that front. If you've got a system alignment intervention and you're looking for organizations to test that intervention, I encourage you to send an email to us, and we'll do the best. We'll let you know what we can provide. It really kind of depends on your situation, and what kind of assistance you might need on that front. Again, if you're a community-based organization, you can definitely tap into the consultation and support from the System Alignment Innovation Hub that I mentioned earlier, as a source of guidance. But encourage you to send an email to our Systems for Action team with a little more detail about the kind of support you're looking for, and we will assess that and do our best to figure out what we can do to provide help. Moving right along. Question about, again, if the research entity and the CBO are one and the same organization, what percentage of funding may be allocated to the prime applicant? Well, 100%. That you are welcome to use the full grant amount. Again, the CFP tells you that if you're using an external research partner, you can allocate up to 50% of the budget to that research partner. So as a maximum, not a floor. You don't have to allocate any portion of the budget to your research partner. It's really up to you as the CBO applicant organization deciding, do you need a research partner and how much of the budget needs to be allocated to that research partner in order to successfully carry out the funding. Up to you. The maximum amount you can allocate is 50% of the budget. The minimum amount is obviously zero. So, it's up to you how you want to equitably allocate the budget across those partner entities. Moving right along. Um, can you subgrant funds to a mobilization outreach partner? Um, yes, you can bring in, you can as the applicant organization, you can decide again what kind of partners you need to successfully implement and evaluate pilot test your system alignment intervention. So you can certainly have multiple partners involved in the project. Your budget could have multiple subcontracts going out to multiple partners playing different roles in the project. So there is certainly that flexibility. You don't need to just have a research partner. You may have other partners involved in other aspects of the project. Question: do small and rural nonprofits frequently get funded, or is this more for larger organizations? I would say absolutely. We have had small and rural nonprofit organizations be successful with um, competing for funds from the System for Action program in the past, and we're certainly open to that. Again, if you've got a novel idea for a system alignment intervention that has the potential to benefit populations that experience systemic racism, uh, encourage you to pursue funding here. Again, this is a research program, and so if your organization could benefit from assistance and support from a research team that has expertise in conducting pilot testing activities and pilot study activities. We encourage you to consider a research partner because this is a research program. This is a research grant. And small and rural nonprofit organizations may not be research institutions. They may not have um, you know um, embedded research teams as part of the organization. So we'd encourage you to think about that issue of could you benefit from having a partnership with a research team embedded at a university or another research research institution that could help with the scientific aspects of the study. But otherwise, absolutely, small and rural organizations are definitely in scope for this funding opportunity. And we have certainly funded projects led by those kind of organizations in previous iterations of the S3A program. Yes, multiple organizations. So question, can multiple organizations apply for the opportunity? Yes. We frequently see proposals that are collaborations involving multiple organizations, but you need to decide only one organization can serve as the applicant organization. So your consortium or collaboration needs to decide which organization is the best position to serve as that applicant organization, and there has to be a single applicant organization to be the lead grantee recipient. And then you can have subcontracts or collaboration agreements with multiple other organizations. Question: can a unique bundling of medical and social services delivered outside the clinic count as a system alignment intervention? Possibly, but just remember, your intervention also needs to engage public health systems in the approach. So that is the hallmark of the S4A program, is testing ways of engaging medical systems with public health systems and with social service systems. So you need to have ways of engaging all three of those kinds of systems in the system in the intervention that's being tested. But otherwise, yes, we have um, um, back almost all of the studies we have funded. S4A today involves bundling or connecting medical delivery systems with social service delivery systems in some way. But again, the third leg of the stool, public health systems, also needs to be a meaningful player in these interventions. I'm going to keep going down our list. We got a few minutes left. If we don't get to your question today, just remember we will be sending out additional responses via email. Let's see. So this next question, so this is a question about partnering specifically with, I think, with the University of Colorado School of Public Health. Um, so again, yeah, so that the national program office for this program is based at our Colorado School of Public Health. If you are developing a project with other other entities connected to the University of Colorado and the Colorado School of Public Health, I'd encourage you to reach out to our office in advance to make sure there's not a conflict of interest. The foundation does have very strict conflict of interest guidelines, and so um, I would encourage you if you're developing a project that involves specifically the Colorado School of Public Health, where our national program office is based, just encourage you to reach out to us in advance and we can discuss that just to make sure there's not a conflict of interest that would preclude your eligibility from the project. Um, Couple of other questions I think I can get to before the top of the hour. Question about how many years of experience do you need to have to be eligible there. We don't have any strict thresholds about years of experience for the organization or for key personnel involved in the project. Your application, you will want to, to make a clear and convincing case that your organization has relevant experience in working with populations that experience systemic racism, and you'll want to show that the key personnel involved have relevant expertise and experience to carry out the proposed activities. It's really up to you to make that case. There are not hard and fast rules and guidelines that we have about minimum number of years of experience about the organization or about any of the individuals involved as key personnel. uh, Question about intellectual properties and that may be created as part of this research. This is research funded by the Robert Johnson Foundation, so the foundation's standard policies um, for disseminating and sharing the results and products from this funded activity definitely apply here. That includes publication of your results in open access, peer-reviewed journals, and also making available any of the other products that are produced by the study. Those products need to be made freely available. If you've got concerns about specific intellectual property issues with products that could be produced by this research, we definitely encourage you to discuss that with us and with the foundation in advance. If there are any of those issues that come up in your proposal, those would be reviewed separately, and we would provide further consultation and guidance with you about that. But in general, the foundation's philosophy is that products from research studies that are funded by the foundation should be disseminated broadly and made publicly accessible, so that the broadest array of people can access and use and benefit from the findings of these studies. Um, so we are at the top of the hour. Again, if I didn't get to your question today, we'll be reaching out through email to answer those issues. Encourage you to take advantage of our weekly office hour sessions. Email us if you have other questions or concerns. And again, thank you for joining us today, and we look forward to engaging with you in the future. Thanks so much, everybody.